Hey, we're back. I'm your host, BKP, and we're at Circuit World here in Blue Ridge, Georgia, and it's time for Ask the Doc. We thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. And here, joining us now, Dr. William Whaley. How are you today, Dr. Whaley?
I'm great. Yourself?
I can't complain. I know I had to pause. You know when you're on a teleprompter and they say they have a pause for
effect.
Pause for applause.
Yeah, pause for applause.
All right. So when I said I can't complain, I had to pause a minute because people out there are saying, "Really, with all the rain?" You know what? We can't complain.
I did come in though, and you were blowing your nose.
Now wait a minute.
Okay, just let me go ahead. Because you think that when it is raining, it's taking the pollen out of the air. And generally when the pollen has been high and a rainstorm comes in, it does that. Tuesday, which was the day of huge rain, was the first time this calendar year the pollen count's gone above 2,000. So simultaneous with the rain, our pollen count was high. And my eyes may be a little red, and I'm doubling up on the Claritin, but people should not be lulled into believing that the rain is keeping the pollen out of the air, because if you just look on these hills over here, they may be soaked, but the flowers are coming out like crazy, and the leaves on the trees are coming out like crazy. So go get your Claritin. That proved it for me. There he goes. All right.
You got me all
Proof
caught
of the principle.
All right.
Okay.
Okay, are we ready for our first question?
Ready to go.
Okay. Our first question. I was recently diagnosed with pancreatic cancer. During the treatment process, will I need to take pancreatic enzymes or vitamins? If so, how often?
All right. What this question, I think, is a very... They either have been diagnosed with pancreatic cancer yesterday, or they're working her or him up and says, we think you might have pancreatic cancer. Because if a diagnosis of pancreatic cancer has been made, then that patient is in the hands already of a multidisciplinary group where a nutritional consultation is step number one, and they will have given those answers already. So basically, I'm going to tell you that during acute cancer treatment, you generally don't need to take vitamins and you don't need to take pancreatic enzymes until after you've gone through surgery and have had your pancreas removed, because the pancreas still functions. But this is a great opportunity to talk about pancreatic cancer in general, because people thought of pancreatic cancer over the long haul as being an unusual cancer, rapidly fatal, and it didn't make any difference who you were, whether you were Steve Jobs or you were that movie actor. If you got pancreatic cancer, you were dead in 6 to 18 months, regardless of what they did for you. So put up that first picture. Pancreatic cancer is the second most common cancer of the gastrointestinal tract that causes death, behind colon cancer. And 1 out of every 8 people get colon cancer. Now, is that because there's a rise in the true incidence of pancreatic cancer, or because we diagnose it more commonly? And the answer is largely we diagnose it more commonly. But if you look at the signs and symptoms of pancreatic cancer, it touches just everything, any symptom you've got. Low mood or depression, indigestion, diabetes, bowel movements being pale or smelly, back pain, abdominal pain, pain in the lower abdomen, weight loss. I mean, everybody's got some of that except you. You haven't got the weight loss. But the last one here is jaundice. So I want you to show that second picture of the arms. People don't really realize the color of their skin, and this is it's kind of hard for you to see it here, but these are 2 arms of comparable people, and this top arm is clearly orange, and the bottom arm is clearly tanny white. So
I can't see it because at home this is black and white, but I do understand what you're saying. I understand that jaundice.
Okay, so now you can take that one down for a minute. So we This geography up here, in the last 3 months, a high number of people diagnosed with pancreatic cancer, which may have stimulated this question, that are prominent public figures. And all of those cases, except one, were diagnosed because of what was called painless jaundice. Their eyes were yellow, they didn't feel a thing. Their skin was yellow, they didn't feel a thing. They ended up going to see their doctor, the emergency room or something, and the pancreatic ducts had blocked off the liver so that bile that is excreted by the liver was lost. Go to that next big old ugly thing. We're not going to make everybody study it. But we show you these every that you work through when you've got somebody that you think may have pancreatic cancer, they've got painless jaundice, or they got epigastric pain, or whatever you do. And the whole idea of this whole chart here, which doesn't require weeks to work through it, it just requires specialists to work through it, is to discover whether the blockage that is causing the jaundice is one that can be surgically handled or not. So give us our nice pancreas, if you would. Got the pancreas up there? So this is a complicated issue here. The pancreas lays back against the vena cava, the artery. It comes over to the tip of the spleen, and the stomach and the small intestines and everything else are on top of it. But where the head of the pancreas joins the excretion of bile from the gallbladder is where the most common malignancies are, and that's this tube there is the small bowel, and it'll block that and you'll be jaundiced. When in doubt, cut it out. You need to remember, when in doubt, cut it out. That's how you handle most malignancies, right? If you can get it out, you cut it out. Well, only 10% of newly diagnosed cancer where they can be operated on. So if you'll remember our breast cancer discussions, when a breast cancer is 2 or 3 inches in diameter, we give breast cancer chemo treatments or hormonal treatments to shrivel that breast cancer down to a point where they can get around it with a surgical procedure. So to treat pancreatic cancer, now we can come back to the nutrition and the vitamins in a minute, you generally have a diagnosis, you turned yellow, you had some abdominal pain, you went to see Dr. Tidman, they did an ultrasound, they saw a mass in the head of the pancreas, you are immediately out of Blue Ridge then. You're immediately at the cancer center at Piedmont or Northside or one of the cancer centers where they do a fancy endoscopy, an ultrasound, and determine whether all these little things up here are lymph nodes. Lymph nodes are enlarged, and how big is the tumor? And you hope the tumor is small enough, right down there in the bottom here, where if you give patients chemotherapy, down small enough to operate it. And once you get to that point where you are interfering with the pancreatic function, which digests foods, yes, you may get the pancreatic enzyme that was in the question. Vitamins are not going to be an issue. Taking that into account, you can then generally convert about 30 to 50% of these 100% of cases to where you can operate on them. So we took 10% of people that could be surgically removed, and we got it up to 30 or 50% that after, say, 2 months to 6 months of treatment can be operated on. And then the issue with the operation is that it doesn't totally remove the tumor in most people, and so you are left with the jaundice has been corrected. If you were having pain, it's gone because the tumor mass is gone. You now have to worry about digestion, taking enzymes, eating the right kind of foods, taking vitamins. But then what's your chances of being cured? Well, only 10% of these people with pancreatic cancer, regardless of whether they're Steve Jobs or anybody else, is going to live 5 years. And if you are aggressive about the radiation and the chemotherapy and the surgery, you can get it all out, then that number may go up to 25 or 30. So that means that most people with pancreatic cancer, even with aggressive diseases, aggressive therapy, are going to succumb to the pancreatic cancer. Once the cancer has been handled, then people say, how do I know how I'm doing? Do I need a scan? Do I need a scan? So this is another one of those things where we have a tumor marker called the CA19, and that's like having a fever. If you got pneumonia and your temperature is 102, and the next day it's 101, I mean, whether you're coughing and hurting like heck or not, temperature went down a degree, you're getting better. And when it gets down to 99, you still feel crazy, terrible, and you're still coughing up stuff, you're still getting better. So what we do is we watch this cancer marker, CA19, and there's lots of non-cancer things that can cause it to be elevated. But if it's elevated in pancreatic cancer, it's a doggone marker about how you're responding. So right now in my practice, I've got about 5 or 6 very prominent people that live in North Georgia, all receiving chemotherapy. All have received some kind of surgical staging or surgery for removal, and all of them are waiting each month for what their CA19 does. So the questioner asked about a bad type of cancer. The concern was, do I need to take enzymes or do I need to take vitamins so that I know that they're not really into the treatment program yet, or they would already be getting radiation, getting chemotherapy, or they'd be waking up from surgery, and all that would have been taken care of by a nutritional consultation. So I just took the opportunity to answer a simple question that you probably won't need to take either, to go through the sort of modern concepts of pancreatic cancer. Now, the last thing I'm going to say is diabetes is caused by a lack of insulin. And the pancreas is where diabetes is made. So if you have chronic inflammatory disease of the pancreas and it scars down from viral infections, can give you pancreatitis, alcohol can, then the development of diabetes frequently will mean the pancreas is sick. It's not frequently malignant sick. It's usually sick with destruction. But once you start operating on it and you can create diabetes by taking out parts of the pancreas, then that's another complication that you could consider be nutritional there. Is that enough of that?
Yeah, and I want to say I really appreciate it, and we know our viewers out there appreciate it, Dr. Whaley, because you go into great detail, which answers a lot of questions, and I can't say how much I appreciate the amount of detail on the questions that Dr. Whaley gives in his answers. If you ever have a question for the doctor, you send it to info, I-N-F-O, at fetchernews.com. Put in the subject line, Ask the Doc. Okay, we want to thank Georgia Cancer Research Center, affiliated with Northside Hospital. And our second question this morning.
We'll stop you right there now. You were talking about doing all this stuff. Now, you remember that what my wife says is.
All right, let me hear.
What does it say? She says, if you ask Bill Whaley what time it is, he tells you how to build a watch. So that's why I try.
I understand, but no, okay. When there's something, pancreatic cancer, and I don't want, all questions are serious.
Yeah.
And they're important to the person that asked the question. Right. They're very important. Pancreatic cancer is very serious.
Scary, isn't it?
Yes, and it deserves the detail you gave it. So now we already know you've been around here on the show a couple years. We know when you're building a watch. We understand that. Okay, and your wife has told us several times. Dr. Whaley, our second question this morning. A few months ago, I was told I'm anemic. What foods should I be eating to improve my iron levels? Are there foods I should avoid? I avoid chicken liver. But go ahead. Just joking.
Interestingly enough, anemia is not a diagnosis. Okay? Fever is not a diagnosis. So if you have a fever, you would want an explanation. Do I have the flu? Do I have pneumonia? Do I have rheumatoid arthritis? So anemia is not a diagnosis. Anemia is due to one of a variety. Let's show that first handwritten one that looks like it was done by a college student. This is the most simple thing in the world about diagnosing an illness that I think everybody, if they stop and think about it and understand it, will put them in good stead for the rest of your life. If you are anemic, that means that your percentage of blood is low. And last week we showed those 3 test tubes, remember? So if you have a low blood count, there are only 3 mechanisms by which that can occur. Here is the analogy that I use with patients. If you are broke and have no money, you either did not produce it or earn it, you either spent it and it's all gone, or you lost it. That's it. I'm broke. So if you have no red cells, it is either I am not producing them, I am losing them, or I am internally destroying them. So iron has got nothing to do with the causation of anemia until you've gone down these pathways. You still got that up there? All right. So over on this.
After 3 years of being in class with you,
yeah,
I really stick on causation.
All right.
I do.
All right. Here's causation. Production defects is on the left, and there's that drug EPO that Lance Armstrong took to build his count up. So you can have abnormal production. And so the first 2, production and maturation, are slow in producing. Survival, that's the internal destruction, and you get that with as I say, sickle cell disease. They got a red cell that looks like a half moon, and it won't go through blood vessels well, so it breaks. And then there are autoimmune, where you get a bad case of a cold, you make an antibody, and it destroys your red cells. You become anemic. Well, no iron in the world is going to help that. And then lastly, the most common causes of anemia are blood loss anemia. So let's go to the next one. And whether you've really got a true case of anemia. And we're not going to spend much time on this, but this looks at kidney failure, heart failure, drugs, and a complicated way of trying to figure out whether you've got a production problem, whether you've got a survival problem, or whether you've got an internal destruction problem. Well, I say keep things easy and not keep things complicated. So let's get rid of that one. And we're going to go back over to this next one that's got the iron deficiency in the middle of it. You got that one? Okay, so if we take our expert panel, and they are all 3 anemic, you would expect the female in the expert panel would most likely have had frequent pregnancies, heavy menstrual cycles, postmenopausal bleeding, or a gynecologic cause of blood loss that dropped the iron, and it would become an iron deficiency anemia. If you were anemic and we proved that it was iron, the idea is not how do we replace your iron, which is best not done by food or by livers or by vitamins. The first thing is iron deficiency is not a diagnosis. How did you become iron deficient? You cannot become iron deficient in the United States without a loss of blood. Now, if you haven't been shot, stabbed, or operated on, and you're your iron was lost in your GI tract. Now, you're old enough to remember that we had a product on the market. It used to be, one of them was called 3S Tonic. Remember old 3S Tonic? Remember those? All right, well, there was 3S Tonic. There were a few more that were advertised. If you're anemic, you take 3S Tonic. Well, the FDA removed those from the market because they did exactly what they were advertised to do. If you were iron deficient, you took 3S Tonic, your anemia got better, but it didn't answer why were you anemic in the first place. So the most common cause of anemia in a male like us or a postmenopausal female is going to be colon cancer. So when you see the iron deficiency, you've got to go figure out where it came from. So in our age group, we'd have somebody look in your stomach, look in your colon. If you had a curable colon cancer, they would find it. You'd treat the colon cancer, and then you'd replace the iron. Does that make sense?
Mm-hmm.
So Triple S Tonic corrected the iron deficiency, allowing the colon cancer to grow big enough to where it would cause obstruction, be too big to be removed, and the patient would die. So 3S Tonic made people well, and Geritol was the other one. It made people get better, they'd feel better, they'd be stronger, but it killed them because it allowed the cancer to grow. So back to the production. Iron deficiency is not a diagnosis. Once you know you're iron deficient, you don't go out and start buying vitamins and start worrying about what foods to eat. You want to know why you're iron deficient. And we have all manner of fancy things. We got patients who have what's called telangiectasias, where you see a little spot on their lip that looks purple. That means they've got those in their GI tract. They can bleed. Most common cause of iron deficiency in a woman under the age of 50 is gynecologic and obstetrical blood loss. But with men, it's generally always stomach ulcers, esophagitis, gastritis, or a malignancy. Now, the two other types of production that need to be looked at. One of them is nutritional, not because you're bleeding. So for iron deficient, you got to be bleeding. But if you got plenty of iron and you're anemic and your B12 level's low, then it would seem like the thing you want to do is give B12, right? Well, yeah, you give B12, the blood count will go up, but why is your B12 level low? B12 is absorbed in the stomach, and if the stomach is getting early gastric cancer, it will not produce a factor called intrinsic factor that's required to hook on the B12 to be absorbed. So you could come in, be anemic and be pale and get a low B12. We could give you B12 and you're well, and a year later you got gastric cancer. So even if your B12 is low, we have to figure out whether it's low because of stomach problem with cofactor, or whether you've got a bacterial overgrowth that's eating up the B12 in your diet, and so forth. So anemia is sort of complicated, and when people hear that they're anemic, then the very first thing that they want to do, and that's what she said a few months ago, I'm told I'm anemic. Give me some iron. That's basically it. That eliminates every other cause of anemia, and taking iron could get you in trouble. So if somebody told you're anemic, you got to go back up to Tidman and say, why am I anemic? And he's just going to turn right back around and send you down to us, and we're going to do a bunch of tests and tell you why you're anemic. Now, you got that one out of the way?
Got that. Got that one.
All right.
We always want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. And now it's time for every time at this time every week, Dr. Whaley shares some medical news that's out there that I'll tell you what, you don't know how many times right here in Little Blue Ridge at Circuit World we break news that the big guys don't have.
We're going to break it with a new fashion. We got a new wrinkle for the program. Have you heard? Did they tell you about the new wrinkle?
New wrinkle for the program. No, I'm waiting. Let me hear this.
All right. You remember this paper I pull up each week? It shows you the there's about probably 1,000 articles, and I have just pulled up a few. Well, they're all new wrinkle. All right.
New wrinkle for the program.
All right, because when I came in here, you had a bottle of.
Yes, I have my
what
little
is that
juice.
Called?
It just says strawberry banana probiotics.
Probiotics. All right. What do probiotics do?
Tell me. You told me earlier, and
what do they do?
The stomach, they
help your gut digest and
In what way? They change the bacteria.
change the bacteria.
That live in
There
your
we
gut.
go. Darn, we would have not passed this test, and he did tell us live.
And I've got this on for everybody can read it. The very first one say, out loud,
high-fat diets do no favors for you for your gut bacteria.
all right, now, this study shows high-fat diet linked to unfavorable changes in the type of number of gut bacteria known as microbiomes. That's what you're drinking right there.
Right.
As well as increasing inflammatory triggers in the body. So right now what you're telling is you're messing with your biomes in your GI tract, and you're not sure whether that's going to do you any good or not. Right?
Right. Okay.
All right, let's drop down to the bottom. Now this is just a random 4 that I didn't know you were going to be drinking probiotics when I walked in this morning, but this is the random top 4 in this week's news. Bottom one.
Gut microbes may help drive lupus, study finds.
What are microbes? Gut bacteria in your gut. Comparing gut bacteria from lupus patients with bacteria from their healthy peers, scientists learned those with lupus have 5 times more of the bacteria known as Ruminococcus gravis. Now, if you read the back of that, it might tell you it had Ruminococcus gravis in it. Now, it may not. Probably doesn't tell you.
I'll do it later.
All right. So basically what I'm telling you is there has been recent proof that people self-medicating with probiotic bacteria, particularly the capsules that you buy in a health food store, change their gut bacteria to the point where they then become psychotic, depressed.
You are in big trouble because I knew that wouldn't take him long.
Psychotic, depressed, and can actually cause them to have adverse behaviors like assault, robbery, and so forth. It sufficiently changes the gut bacteria to where the byproducts, kind of like if you were taking drugs or alcohol or something, mess up your brain. So that is it's important not to just grab it. But if you want probiotics, my suggestion is you get kefir, which is the yogurt-like product. You eat some yogurt or some buttermilk or some cottage cheese, and not try and overwhelm it by something that some health food guys has packaged.
You know what? I appreciate that because I didn't realize everything you just told me, and I thank you for that because you have good bacteria. People think of bacteria. You have good bacteria, and that's why sometimes a doctor may tell you to eat some yogurt. Correct?
Right. And doctor might make a mistake by giving you an antibiotic for a cold.
Right.
That kills the good bacteria. Then you end up in the hospital dying of C. difficile. All right, one more because this is going to make one of the expert panel really happy. What does this one right here say?
Acupuncture could help ease menopausal symptoms.
I just wanted to go to the alternative medicine because I think this deserves to be highlighted. This is a great big long Danish study done in tens and thousands of women that, quote, clearly demonstrates menopausal symptoms can be treated with acupuncture. And I just wanted to say this I wanted to say this to the conservative member of the expert panel that some of this is good, and I just want you to hear the expert saying so.
I'll watch the rerun.
Okay.
All right, last one, I'm going to stop.
Okay.
There's some for-profit clinics that recently started up about stem cell transplants. I told you to watch out. The guy says come and get a stem cell transplant, cash only. It's not paid for by insurance. Young blood clinics are all shut down after the FDA action. FDA shut down every one of those clinics in the United States yesterday that transfuse either young people's plasma into you to make you not age so long, or give you stem cells for some purpose that is not proven.
You know, let me say this before we go, because I think probably there's no higher compliment than the compliment you get from a mom.
Yeah.
Okay. So this past week, I want to share this with you. So this past week, I was talking to my mother, and I brought you up. I was talking about you to my mom. Okay. And my mom said, "Is that the doctor on Friday I watched with you?" And I said, "Yes." And she said, "He seems like he knows what he's talking about." So you can't. So you seem like you know what you're talking. You can't beat a mom's compliment,
That's
but
good.
that comes from mom. Listen, thank you, Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment, Ask the Doc. Now, don't forget, you can ask Dr. Whaley a question. You send that to info at fetchernews.com. Put in the subject line, Ask the Doc, and we'll get it over to Dr. Whaley so he can answer your question right here on the air. Also, if you want to share these segments with your friends, you find our YouTube channel, FYN TV, Fetch Your News YouTube channel. Click on playlist, click on Ask the Doc, and all the segments are there. You can share with your friend. I'm your host, BKP. We're at Circuit World and Blue Ridge, and we're going to take a brief break, and we're going to get the all-star political panel in here, and I wonder if they have anything to talk about. How about you? We'll be back right after these messages.